This is the 4331 HIM class project about the gender association of congestive heart failure and emergency room visits. The associations between gender concerning congestive heart failure and emergency room visits percentages of patients show that many hospitalizations begin with the ED visit. Heart failure accounts for over 1 million hospitalizations annually and is one of the most common causes of at least 30-day hospitalization in the United States. Congestive heart failure affects millions of Americans, mostly over the age of 55 years old. The association between congestive heart failure, or CHF, and ED visits populate a significant percentage of patients being admitted to the hospital after an emergency room visit for heart failure. Many of the hospitalizations for heart failure begins in the emergency room, as stated earlier. The emergency department provides a significant source of medical care in the United States, and with over 1 million total emergency visits completed annually. The term congenital means existing at birth. The term congenital health disease can be considered the same defect. The heart ailment is a defect or abnormality, not a disease. A defect is the outcome when the heart or blood vessels close to the heart does not develop normally before birth. Heart failure doesn't mean that the heart has stopped working, but that it just isn't able to pump enough blood to meet the needs of the body. This is called fluid congestion, and for this reason, doctors call this congestive heart failure. Gender association between congestive heart failure and emergency room visits was collected during a descriptive correlation design study. Many advances have been made in the treatment of congestive heart failure. The Centers for Disease Control and Preventive, acronym CDC, from 1996 to 2008 provided a total of ED visits that has shown to have been calculated using the student t-test, calculated 95% confidence intervals, and performed regressive analysis in the Framingham Heart Study. The Excel descriptive and statistics tests that were performed listed variables such as admission source, gender, observed counts of genders being admitted by the emergency department, percentages of patients gender-based versus admission sources. The gender samples consisted of 412 visits of collectively both male and female patients that have been diagnosed with congestive heart failure in the emergency department for every 1,000 individuals. More than 5 times as many men compared to women who visited an emergency room were discharged as were admitted to the hospital. Men visits resulted in hospital admissions by a total of 7.9% more than women's visits, which calculated out to 3.2% from the American Heart Association. Life-prolonging treatments such as ACE inhibitors, beta blockers, in the age range of 70 and over was significantly higher in men than women. Nationally, at the age of 55 years of age, the ED visits resulting from men and women are ranking at equal amounts for congestive heart failure. Or can be considered the same. However, women tend to live an average of 7 years longer with a diagnosis than the male counterparts. So basically, I know that was kind of jumbled, but women tend to live an average of 7 years longer than men with the same diagnosis. Gender differences between congestive heart failure and emergency room visits are ranged between the ages of 50, give or take 14 years of age for both sexes. Heart failure with systolic function is more common in women than in men. However, the differences in the myocardial response to injury has a lower prevalence of heart disease in women at all ages compared to men. The size of evidence collected for treatment of congestive heart failure in women is smaller than for men, mainly due to the data collected by clinical trials. Base evidence from the public health system viewpoint is the implementation of evidence of all patients, irrespective of gender. The main factor and one of the most important factors of the entire research is the key factor in improving the outcome of all patients with heart failure, despite age, gender, ethnic background, financial status, cultural beliefs. The key factor is improving the outcome of all patients. The outcome of the study is gathered from statistical calculations of the research. The p-value was less than the level of significance, which equals the answer to reject the null hypothesis. The test statistics fails in the rejection region. The incidence of heart failure is lower in women than in men of all ages. That was the outcome of all of the data collected. Due to the increase of incidence, the total number of men and women living with congestive failure is similar in ways, while men are populating as higher in statistics of differences between the genders. The study's limitations interpretation of the finding has showed variables in the National Hospital Medical Care Surveys. They have been modified over time. Therefore, the data collected was varied. The language related to the study was multiplied multiple times during the study, which affected the outcome. The study did not account for the ongoing effects of the policy changes, which includes public reporting and financial penalties for heart failure rehospitalizations. Those are some key factors and very important information that could have contributed even more so to the research of gender association of congestive heart failure and emergency room visits, which suggests that the gender differences in time to treatment were not largely attributable to traditional proxies for hospitals, qualities such as volume, but possibly due to teaching of. So in conclusion, my findings is that it is of the utmost importance to listen, to review patients' medical history, and to focus on the objective to provide adequate care. Opportunities may and will continue to exist concerning congestive heart failure and emergency room visits. The goal is to reduce hospitalization by increasing short-term management for all patients. So the key factor in improving the outcome of all patients with healthcare is just to work hard. Let's listen, focus, reduce economical stresses as far as allowing. In conclusion, opportunities may exist, but hopefully we can reduce hospitalization by increasing short-term management with congestive heart failure for all patients, emergency room patients, overall all patients. So once again, the one of the most important factors is improving the health outcome of all patients. with healthcare. Thank you, and this has concluded my research recording.